Thank you for joining my Tech Talk. My name is Bonnie Barty. I work for the Department of Veterans Affairs as a simulation technician. My presentation is titled Simulation-Based Medical Communication Training Using Generative AI Models. Regarding disclosures, I have no relevant financial relationships to disclose relating to the content of this activity. The views expressed in this presentation are those of the author and do not necessarily reflect the official policy or position of the Department of Veterans Affairs or the U.S. government. The current learning objectives for this presentation include describing artificial intelligence, AI, in medical simulation, discussing how AI relates to modeling and simulation, describe the current research and development R&D process for AI in the Veterans Affairs, provide a framework for how AI is used today and why it is important, and theorize future applications for AI in the VA. Before we continue, we need to understand the terminology of AI. Artificial intelligence is defined as technology that enables computers and machines to simulate human intelligence and have problem-solving capabilities. AI has focused on learning, reasoning, problem-solving, perception, and using language. There are two methods in AI, either a top-down, which is a computer program such as Siri, approach, or a bottom-up, where we're training the AI. Applied AI is available to produce viable smart systems, such as medical diagnosis systems. AI's purpose is to augment or enhance how we operate. I included this timeline of AI to show its developmental history. It actually started in 1950 as the first documented information for AI. And in 1964, it took a break until 1997. There were a few items on this list that most people would recognize, like when 2002, when the Roomba came out, or in 2011, when Apple integrated Siri into their phones, or in 2014 when Amazon launched Alexa. 2020, ChatGPT came out. In 2022, ChatGPT is made public. History timeline of AI, machine learning, and deep learning. AI began in the 1950s. This was computational methods allowing a computer to mimic human intelligence. In the 1980s, machine learning, algorithms able to learn without being explicitly programmed to do so. In the 2010s, deep learning, AI models of high-level abstraction in data by using a deep graph with many processing layers. Now that we understand a little more about AI, why do we need AI in the VA? The VA has 9.1 million patients. The VA is the largest integrated healthcare system in the U.S. There's 120,000 clinicians. The majority of U.S. doctors and nurses do at least some of their training at the VA. There's over 1 million genomic donations. The VA has the largest genomic database tied to medical records in the world. 10 billion medical images. The VA has one of the largest medical image repositories. 1,200 plus medical facilities. Veterans receive care across all U.S. states and territories. There are 2.2 million telehealth episodes per year. 1.2 million more than 727,000 veterans are being served by telehealth per year. All agencies within the government, including the VA, require supporting documentation. In February of 2019, an executive order was created titled Promoting the Use of Trustworthy Artificial Intelligence in the Federal Government. In 2021, the VA AI Strategy Report was created. In May of 2023, the National Artificial Intelligence Research and Development Strategic Plan was created. And just recently, in December of 23, an executive order titled Safe, Secure, and Trustworthy Development and Use of Artificial Intelligence in the VA was created. Out of that creation came the AI Oversight Committee, the AI Institutional Review Board, and the creation of the National Artificial Intelligence Institute. Previously, I mentioned the VA AI strategies. These include using existing AI to improve outcomes and experiences for veterans, increasing VA AI capacity and capabilities, increasing veteran and stakeholder trust in AI, and building upon the VA's existing partnerships across agencies and industry. In simulation, the stakeholder trust is very important. Building trust through education using AI will help to break down resistance using a new technology in other areas. Describe how AI relates to M&S. A subject matter expert has expansion of knowledge, specific problem solving, identification of techniques, and evaluation of techniques. The learner has expansion of knowledge, verifying knowledge, and repetition of skills for competence. The VA hospital has state-of-the-art learning methods, cost savings due to less staffing, and expanding learning methodology. The Simulation Center has expansion of knowledge, curriculum development, and alternative simulation method. AI platforms provide expanded learning opportunities. How can AI support communication within simulation? The current methods of communication within simulation-based scenarios include mannequin-based scenarios, scenarios with standardized patients, or VR, AR, XR computer-based, which includes typing questions. The challenges with these type of simulations are the availability of staff to complete in-person simulations, obtaining and training standardized patients, and reducing fidelity in conversations through typing to communicate. How can AI assist simulation with gaps and challenges? The current gaps are problem-solving skills, enhancing learning experiences, improving clinical decision-making skills, interprofessional communication skills, health equity scenarios, and practicing team steps. The challenges include technical challenges requiring technical expertise, infrastructure, and investment in software and hardware. Students hesitant to embrace AI due to unfamiliarity, perceived complexity, or perceived validity of content. The need for realistic and feasible implementation. Current AI communication cases and simulation can help with the gaps and the challenges through patient identification, introductory history taking, establishing presenting complaint, rapport building, psychosocial assessment, delivering bad news, de-escalation, disclosure of error, wound assessment, and early management and intervention. The current vendors that are using AI for modeling and simulation include NASCO Healthcare, PCS, Lumeto, SimConverse, and Virti. Many of the other companies out there that are doing simulation are following this model and will soon be coming out with AI. Some of the attributes of current AI simulation programs include scenario-based enhanced learning, objective-driven role-play scenarios, diverse and inclusive practice. AI trains the verbal, words and grammatical structure, and paraverbal, tone, cadence, and inflection. Learner access from any device. The virtual patients learn, adapt, and react to the learner's actions. Tailored feedback based on the objectives. Debrief based on strengths and weaknesses. Reflection using Kirkpatrick steps. And it's safe and repeatable practice. A few current VA R&D processes for AI may predict future simulation education routes. These include ultrasound and radiology for interpreting, diagnosing, and predicting outcomes for illness found in images, process automation for patient note creation, understanding heart failure, finding targets for prevention and treatment, enhanced endoscopy to diagnose real-time polyp histology, cardiovascular risk assessments, teledermatology images for diagnostic classification decision tool, precision perioperative prediction before surgery, and predictions within overdose, remissions, and hospitalization. Another resource within the VA is the current Microsoft Teams channels for AI. These include general information, AI in health informatics, applications in natural language, artificial intelligence meeting minutes, blockchain in healthcare, clinical use cases, community of practice, COVID-19, data ethics, regulatory, AI in nursing, coding, trustworthy AI, and the water cooler area. Theorizing future applications for AI in the VA may include integration of AI into simulation program learning model, clinical encounter simulations, clinical diagnosis within simulations, treatment plan simulations, team communication and patient communication, curriculum and medication error simulations, and scenario creation for complicated cases. In summary, I've provided a basic understanding of AI, described AI in VA medical simulation, discussed how AI relates to VA M&S, described the current R&D process for AI in the VA, provided a framework for how AI is used today, and theorized future applications for AI in the VA. This area is for question or comments. For further information regarding the Office of Research and Development for the VA, a website has been created featuring how the VA is building collaboration, why the VA is researching AI, the AI Summit in healthcare, pilot projects with the private sector, AI use cases with summaries, and training courses to learn AI. The website is below. This is my reference page. The 3 references here listed were used within this presentation. The last slide is my contact information. I am currently at the Southern Nevada VA Medical Center in Las Vegas. Thank you again for listening.